Hello, podcast listeners. You are now listening to the Coffee, Health, and Science podcast. I'm your host, Jordan River, and I want to thank you for tuning in today. Before we get started, I urge you to share the show. Spread the Coffee, Health, and Science podcast to a coffee lover, to someone who's into health and fitness. Just share the show, folks. It really helps us out. Subscribe so you catch every episode, and give us a good rating and review if you would. Thank you. Today we have a repeat guest, one of my favorite people to speak to on this program. From Pineapple Health, we have Dr. Kevin Chan. How's it going, Dr. Chan?
I am great. Looking forward to speaking with you again.
Yeah, absolutely loved your last episode, man. I mean, when you take a look at modern health and fitness, modern diet research, fat is maybe one of the hottest it might be the hottest topic, like fat and sugar. So when you came on last time, you had so much great knowledge to share, and I just want to thank you for taking another crack at the Coffee, Health, and Science podcast here.
No, absolutely. That's the reason why I become a specialist in fat. Right, I call myself the fat doctor, hopefully not a fat doctor, as a lipidologist, right? There's only a handful of like maybe 950-ish of lipidologists in America.
Whoa.
I mean, board certified lipidologists. And there's only like a handful, like 15 of us, maybe in Arizona. So I mean, to me, that I was like, wow, but you're absolutely right. Fat is probably the most discussed topic, second to sugar. You're right. So I have a lot to say about that.
Love it, man. Absolutely love it. Pineapplehealth.org is where you can find all of Dr. Chan's work. What have you been up to since last we spoke? We're kind of, we feel like we're coming out of the backside of pandemic here. Hopefully permanently for the foreseeable future.
Well,
what are you up to at Pineapple Health?
I'm sure something else may come up in the future. It may not be the same thing, but like everyone else, I am very active in preparing to research, right? To research from my, pre-COVID with many new offerings that I'm planning to launch sometime this year.
Oh, can you talk to us just briefly about what those might entail?
Well, okay, very briefly, right? If I meet someone in the elevator and they say, "What do you do?" Right? Pineapple, like, come on, right? So I said, okay, I'm not going to give you a lecture, right? Because I know that you have a attention span of 4 seconds, right? So all I'm saying is everything under Pineapple Health is anti-inflammatory. So everything I do in the office is anti-inflammatory. And so, if you have a chance to look at my website already, I focus on hormones management, optimization, environmental allergy treatment, things like that. But a big piece, though, of my practice, right, is lifestyle management. But for over the years, though, I have not really been able to really create a more robust version or a more robust program for my lifestyle. So one of the first thing I want to do, from summer onward to the fall, is to launch a very robust, very organized, right, lifestyle management, weight, fat management program to complement what I'm doing already in my office.
I love it. I love the anti-inflammatory focus. I mean, that's, again, another hugely hot topic that ties in with everything we're saying. I absolutely love it. Like I said, pineapplehealth.org is where you need to go, listeners, to find out everything that Dr. Chan is doing. On our last episode, we dove into the differences between healthy fats and unhealthy fats, right? And you really highlighted animal fats versus plant fats. But I wanted to talk to you about, kind of dig into that and talk to you about what types of plant fats. Because, you take a look at these substitute fats, right? Like since the fat-free craze of the 90s, that's kind of when I grew up, and the early 2000s, we've only gotten more obese. We've only had more heart disease. And a lot of these oil products come from like soybeans or corn. So it's like those are plant fats, but they're not the fats that you're talking about. What are your thoughts on like oils, substitutes, and fat-free products that contain those types of, oils and substitutes?
Yeah. I mean, again, this could be an hour long, not longer lecture on the science behind fat, right? But of course, I can give you my opinion, which hopefully is scientifically and medically based, that, well, depending on what you mean by substitute, right? I mean, substitute could be a more natural form of substitute versus synthetic, So if you're talking about something that is synthetically made, like, I remember one of my mentor used to talk about, you want to have your fat from a plant, but not from a plant as a factory. So if you have a chemical, right, that is made in a plant, like a factory plant, which
Right.
is synthetically made chemicals substitute for fat, then probably it's not good for you, depending on the type of chemicals you're talking about. Especially those chemicals are not what we need if something made, and to simulate what fat looks like. So probably our body is not able to digest or metabolize correctly,
Right.
then that could be a problem. Now, second to it was what about natural? Well, that depends on what type of natural fat you're talking about. Natural plant fat, if they're processed, just like what I said earlier, even though they are natural, they're not
Good point.
completely synthetic,
Such a
but
good
they're
point.
still, yeah, but they're still modified, right? They're
Right.
natural, but we do something to them and we modify them so they're no longer 100% natural, and that could be as bad as something totally synthetic as well. So it depends, really depends on what you're
Wow.
talking about,
That's eye
right?
opening. But I guess, it's interesting because you take a look at some processes. So I'm thinking about oils and specifically, right? And what you just said hits the nail on the head. Take a look at something like olive oil, which I have to assume you're a fan of, right? Do you stand by olive oil as a healthy fat product or no?
I would err toward perhaps by maybe more virgin base or cold press base, right?
Oh,
Than regular olive oil. But I would say that, overall, right, polyunsaturated, right, fat, or even right, or monounsaturated fats tend to
okay.
be more beneficial
Better. Okay.
than totally saturated. Of
Right.
course, you're gonna ask me. I know. You're gonna ask me. What about coconut? Right? Coconut,
That was
like,
my
is
next
is
one.
is
Yeah.
huge, right?
But that
Right?
one's
We
I
know
see
that.
I see studies for good and bad constantly.
Exactly. So it depends, right? I mean, once again, I always argue against that one size fit all medicine, right? I
Sure.
mean, even though coconut, yes, if you look at that from a lipidology context, it is saturated, it is bad, and it may not be right for you, especially if you have pre-existing heart disease,
Right.
or if again, right, depending on what your labs have shown me, that maybe you're already very inflamed in your cardiovascular system, and then that may not be right for you. However, I know that there are good, at least some data, right, suggesting that maybe coconut oil or even MCT equivalent might be beneficial for the brain, right? So, and that goes the same thing with fish oil, right? I mean, I'm sure we talk about that too. That, hey, there are two major component of fish oil. I'm talking about omega 3, right? I
Yeah.
mean, so the other oils that you're talking about are more like omega 6 or 9, which again, most of the time we associate omega 6 as inflammatory and may not be as good. However, we do realize that in some research, it also suggests that, well, yeah, omega 6 may not be as good as omega 3, but we still need some of them.
Oh,
Right?
interesting.
It's just that in our modern society, we may have too
Way too
much
much, right?
omega 6,
Wow.
right? But it doesn't say that we don't need omega 6 at all.
Hmm.
We just need a lot less. Now go back to, so we talk about fish oil is mostly omega 3,
Hmm.
and omega 3 has both components of DHA and EPA. And we know that EPA is really good for the heart, right?
Hmm.
But one thing that we don't know, that we don't say enough about, is, however, DHA though is really good for the brain, right? So again, depending on who you're talking to, if my patient is very concerned with their heart, right, then I would say, okay, then we might want to focus more on the EPA version of omega 3, which is better for the heart, because everyone says, oh, DHA is going to raise your cholesterol. It may not be as good. But what they don't realize, though, that is for a patient who may be prone to brain disorders, then I would say, I'm not so sure if I'm going to leave out the DHA so soon,
Wow.
because DHA, on the other hand, has great evidence for brain health, right? So I sometimes I get caught in this battle between, should I protect my heart or should I protect my brain? And I will always say, no, no, no. Yeah, I think we need both. I wouldn't say I need more one than the other. So I will always try to get a balance between how can I protect both the brain and the heart.
Wow,
So
that is
whenever
fascinating.
possible, yeah, whenever possible, I still urge to use both. I still use both DHA and EPA, right? Once again, I'll be more cautious. If a patient has heart disease, then I may use less DHA maybe, right? But if a patient comes to me and say, we have no family history of heart
Yes.
disease, but
Yeah.
we have a whole line of pedigree of patient with dementia, right? So I would love to delay onset of my Alzheimer's disease, perhaps as much as possible. Then maybe I would be more open to
Wow.
using DHA, in combination of EPA as
And
well,
in
right? So
combination with
I yeah,
coffee, of course. Don't forget, you're talking about dementia. You put them on the coffee. You don't have to say it,
and
Dr. Chan. We know you already do that.
exactly. And you and I both know, right? Just like, I mean, you asked me that question the other day, and I say, again, anything that you can buy over the counter, just like coffee, right? I mean, they're not all the same in terms of quality, right? In terms of the doses and in terms of potential contamination.
Yes.
So again, right, you cannot just say, oh, all coffee are good or all coffee are bad. You know the answer to that.
Very true.
Okay.
I'm concerned about that with the fish oil, though. It's interesting. I speak to some regenerative agriculture specialists, and they say how they won't use sea-based products anymore because of what we've
I
done to the ocean
know.
and how
I
bad. I mean, just in the
know.
past couple of decades, it seems to have really changed. Are you concerned about?
I am.
Hey, it's
I
good for
am.
you, but if it's coming from a poison ocean, there's going to be, like you said, issues down the road, contaminant issues, and that's really a problem.
Yeah, so I mean for now, I think, I mean, again, it's beyond the scope of today's discussion, but
Right.
of course I will find, which is why it's so important, don't get me wrong, I don't know how to say that. I guess I would say that as politically correctly as I could, but again, I would be very cautious if you just buy your fish oil randomly
Right.
anywhere, because again, I would not openly, right? I cannot say that they are bad. Of course not. I just cannot say that they are good. I don't know. So
Wow.
when patient asks me, right, can I just, and again, that's my position. I said, legally, I will not say anything bad about anything over the counter because I don't know. But I just cannot say how good they are, right? Even though they may not be bad,
Right.
I just don't know how good they are. And there are certain criteria that I use, like professional brand, nutraceutical. They must have certain seal, right? Especially one of the things I mentioned that is IFOS. IFOS is to me, one of the most uh, important or prestigious credential to certify fish oil brand, right? That to
Ooh.
show that they really have the least contamination.
Certifications by
So
Nutrisource. Love it. IFOS, IFOS. All right, there we go.
yes.
Because I was going to ask you, what can we look for? Because again, we're obviously headed in that direction, especially with the way the oceans are going.
I mean, yeah, you
That's
want
true.
base. I mean, every company would hopefully, right, would seek to at least GMP certified, right, and but I'll look for IFOS as well. In
Cool.
fact, in my practice, I exclusively use a company that is IFOS certified because that's how I can trust that there's probably the least, if not zero, contamination of the fish oil that I recommend to my patients.
Amazing. I like the personalization, like you said. I like tailoring it to family history because we might not understand the genomics yet, but I mean, take a look at the history of the person and how they're doing. It's right up our alley here on the Coffee Health and Science podcast, man. Great advice today. Before we wrap it up, I have a couple more questions. I got milk questions. I think we brought this up last time. I could be mistaken, but I want to go deeper because I know last time you said, cow's milk you're not a fan of, but there's so many different types of milks. Can you run down, almond, oat, soy, these types of things and your thoughts on them from a health perspective?
Yeah. Very briefly, I am okay with dairy, cow's milk though, if you are a cow,
You
and
got me.
right, and especially if you are a baby cow, that is, you know what, it's perfectly
Outta here.
perfect for you. Please stick with dairy cow's milk if you are a baby cow. Now, on the other hand, let me talk briefly about I said coconut, I think is okay, although controversial. Almond, I think is based on what I read and learned. I think is pretty neutral, right? I think it's fine.
From a health perspective.
Yeah, exactly. Now, from oats, there are some studies, although controversial, depending on who you talk to, right? May have something to do or a concern with patients that has celiac disease, right? Or gluten.
Right.
At the very least, gluten. I mean, if not celiac, right? Maybe gluten sensitivity.
Wow.
So again, that's controversial. I will speak to the patient individually about that concern. Soy. Now, depends, right? If you're talking about naturally made soy from, grandma making soy drink for you, those are probably okay, right? We know that for sure. Soy milk drink, if you use it early on for girls, there is a good chance that they have decreased risk of breast cancer, provided they start to consume their soy milk early on, right? But too much soy milk may not be, again, this is one of the controversial issue now, may not be as good for guys like you and I, because there's some suggestion and evidence showing that, well, soy being a what do you call a estrogen
It's like an estrogen blocker, like an
right?
endocrine disruptor.
Well, in a way, modifier, right? Then there is some suggestion that is actually lowering the action of testosterone for guys, right? And also from other studies I have read, although from years ago, that especially processed soy may also associate with low thyroid, right? So that's another thing that we have to watch out. Is okay. I mean, nothing really, is like. That depends on maybe love, right? Maybe love is the more the better, right?
No one's allergic to love,
right?
Yeah, that's
perhaps,
a good point.
right? But anything else, though, I mean, we have to really look at, well, when you don't have enough, maybe it's not good for you. But when you have too much of it, may not be good for you either, right? So you really have to individualize. But overall, I think soy, right? Natural, non-processed soy probably is good, for girls, right? Maybe more than for men. And it seems like they do show some benefit from a cardiovascular standpoint, right? In terms of cholesterol lowering, although that may not be very robust at this point. But it seems like soy have some properties on lowering cholesterol and therefore may protect from heart disease. But again, the processed soy is what more concerned with, issues with thyroid, things like that. So,
wow, man,
I hope that helps.
Very eye-opening. It really did. While I have you here, we're talking about, kind of what we supplement things like our coffee with. Let's talk about actual supplements, though. When you take a look at multivitamins and you mentioned fish oils and all this stuff, like what is your top supplement to recommend that you think we need today in 2020?
Yeah, I think today, especially with regard to the pandemic, right? I even tell my patient that, even if you got the vaccines, right, it doesn't mean you're 100% protected. Why? Because there is a window between the injection of your vaccines to the development of your antibodies, right? As we know, as we get older, as my immune system get more senescent or aging, then there will be a longer time period between vaccination and the production of antibodies. So we still need something to boost our immune system in general. In fact, studies have shown, right, during the past year that vitamin D have some positive indication to either decrease risk for patient contracting COVID, or for those who have the virus, right, is less likely to develop a complication. So my number one supplement, always been, especially today, right, is vitamin D, right? But remember, you want to take D3, and also remember, you've got to get vitamin K, right? Especially K2 to go with vitamin D3, because K2 would help the D to go to the right place, right? To speak in very simple terms,
Helps
right? Simply,
that sort of thing.
Right, because simply D3 alone, some study would suggest that, hey, if you get too much of it, that may increase your risk of developing kidney stones or things like that, right? Do you want your calcium? You're right. Vitamin D3 will help absorption of calcium. So the calcium, well, where do you want the calcium to go? Do you want your calcium to go to your bones, or do you want your
kidneys.
right, or your kidneys, my favorite, right, your arteries, right, your heart.
Right.
So where do you want your calcium to go to after your intake of D3? Well, you want to go to the right place, and K2 plays a big role.
Wow.
Right.
I'm not
So
taking
again,
K with I need to take K with my vitamin D. What?
Yeah. So again, I how do I say that? In my office, right? Again, we use professional brand nutraceutical, right? That I know that again has shown that has the least contamination and the most appropriate, correct dosage, right? When they say they have 5,000 international unit, it has 5,000, right? Not 600, for example.
Right.
But anyway, so yeah, in my office, we only use vitamin D3 that comes with K2, right? You don't want to do, you don't want to take two supplements separately. You could, I guess, right? Or take only D3, because if you only take D3, then you may run the risk of having too much calcium, and that calcium may go to some other places that you may not want them to go.
I see. Yeah, I see that they're paired together frequently. Okay, wow. Man, every time you come on the show, it's like jam-packed full of information. So vitamin D is what we're lacking, and I hear it all the time. And there you have it, folks.
Don't get me wrong. That a lot more supplement I would love to talk about. But if you ask me if you can only take one, especially today's standard, absolutely, vitamin D is so much. It actually is a pro-hormone, if you will, and it has so much more, functions on immunity, improving bone health, as you know, decreasing fatigue, pain, depression, decreased risk for diabetes and cancer, and even blood pressure. So there's so much benefit of vitamin D. And everyone, when I test them, everyone is low. Everyone.
That's what I hear. Virtually everyone is low on vitamin D, and it's because we're biologically, what should I say, ancestrally, we're meant to be outside half naked most of the day, which you and I just don't do as we work as a podcaster and a doctor. Is that the idea behind that?
I think there's, I don't know how proven they are, but at least there are theories that I can talk about that we were so concerned with skin cancer, which is very legit. Very legit, don't get me wrong, right? So because of the concern of skin cancer, we put an inch of sunblock on our face,
right.
and so that may contribute to, right? And another theory is stress, right? It seems like stress could affect everything. So again, right, if there's stress, it may affect our conversion or to produce, right? So again, at least in theory, that makes sense.
Man. This listen, we're up against it already. It's always jam-packed. It's the only way I can say it. I know I'm repeating myself here. Dr. Chan, what's next for you? Where can my listeners find more of you? Obviously, pineapplehealth.org. What's next?
I would think, I don't know. I guess, if I hope that Jordan can invite me to come more frequently. Maybe that's one way. Maybe Jordan can help me to develop my own podcast at some point in the future. So yeah, because I would love. It's not practical, right? For expect my patient to come to my office, but a better question to ask me, right, would be, what can I do to bring Pineapple Health to you guys? And that's exactly what I'm thinking right now. Is what can, right? Not just what can I do to have you come to my office? Come on. I am in Phoenix, right? Do I expect everyone? No. It's not realistic. It's not practical. But I need to ask myself the question: what can I do to make me more available to all of you? That is what I'm thinking about every day.
Podcast. That's the answer, buddy. Okay, we'll absolutely discuss that. Thank you so much, Dr. Kevin Chan, for this excellent interview, and we will absolutely help you launch your own show. I would love to see that, and the listeners would too. So stay tuned, everybody, for more Dr. Kevin Chan, for more Coffee, Health, and Science podcast. We're signing off. We're saying have an extraordinary day out there. Bye-bye, everyone.